Thank you for joining this brief presentation to learn more about the annual Synar program and how you, as a county or municipality clerk, play an important role in our process. So first off, what is Synar? Synar is actually not an acronym. This amendment was named for its sponsor, Congressman Mike Synar out of Oklahoma. In July 1992, Congress enacted the Alcohol, Drug Abuse, and Mental Health Administration Reorganization Act, and this included the federal Synar Amendment, which aims at decreasing youth access to tobacco. The Substance Abuse and Mental Health Services Administration, or SAMHSA, oversees implementation of the Synar Amendment, which requires states to have laws prohibiting the sale and distribution of tobacco products to minors. The Synar program has been successful in reducing youth access to tobacco through retail sources. So there's a number of program requirements that come out of Synar. Synar requires that states enact and enforce laws prohibiting the sale and distribution of tobacco products to individuals under the age of 21 per Nebraska Law 28-1418. Previously, this was under the age of 18. However, this change to align with the federal Tobacco 21 law became effective in Nebraska October 1 of 2020. The goal of the Synar Amendment is to reduce the number of successful illegal purchases by minors to no more than 20% of the attempted buys by minors in each state. Synar is a critical component of the federal Substance Abuse Prevention and Treatment Block Grant. States that are not in compliance with that 20% violation threshold can be at risk to lose grant funding or be put on a corrective action plan, some requiring more resources to put towards tobacco compliance. So the way that we measure this is that states measure progress in reducing youth access to tobacco through annual, random, unannounced inspections, and this is known as the Synar Survey. The inspections that occur must include at least 80% of tobacco outlets in the state and sample both over-the-counter and any vending machine locations accessible to youth. The sample size must be large enough to meet precision requirements, and the completion rate must be at least 90%. SAMHSA, through its Center for Substance Abuse Prevention, or CSAP, the Division of State Programs, annually reviews each state's Synar survey and results and provides technical assistance to help states comply with the requirements. For the compliance checks, law enforcement follows a standardized protocol approved by the Division of Behavioral Health and SAMHSA. The Division of Behavioral Health contracts with the Nebraska State Patrol and Omaha Police Department through Region 6 Behavioral Health. Underage youth, ages 15 through 20, attempt buys of tobacco. This has been updated from the Nebraska law change that went into effect on October 1st, 2020. Youth inspector ages were raised to 20 years old per Nebraska Law 28-1421. Law enforcement then accompany the underage inspector to conduct annual unannounced inspections in a way that provides a valid probability sample of tobacco sales outlets accessible to minors. Any entity that sells tobacco products may be visited, and this includes sellers of smokeless tobacco and vape shops. Successful buys are issued citations by law enforcement and overall impact the retailer violation rate for the state. The Synar process takes an entire year in length and runs by the calendar year of January to December. Activities occur throughout the year, and many of them coincide with each other. All tobacco retailer licenses in Nebraska expire on December 31st. Most retailers will renew their license for the following year around this time. Initial mailings to county and municipality clerks go out the first week of January, with reminder emails and calls about 2 weeks later. By the end of February, the Division of Behavioral Health finalizes the license list of all tobacco retailers for the state of Nebraska. In March, contracts are executed with law enforcement. Throughout April to September, annual unannounced inspections will occur in a way that will provide a valid probability sample of the tobacco sales outlets that are accessible to minors. It should also be noted, retailers may be subject to compliance checks outside of Synar. regions and counties choose to conduct additional tobacco compliance checks throughout the year. The FDA also conducts federal checks as well. The Division of Behavioral Health will then analyze the results of the Synar survey and submit an annual report detailing state activities and the final retail violation rate to enforce its law by December 31st. Between the time of January and February, this is where the division greatly relies on the assistance of county and municipality clerks to get the most accurate information of all tobacco retailers in Nebraska. Each clerk will receive a mailing from the Division of Behavioral Health with these 4 items. You'll receive an updated letter from the director explaining the Synar program. You will also receive your county or municipality form, a copy of current tobacco legislation including any updates, as well as a past year's list of your county or municipality's list of tobacco licenses. So here are the steps we're asking the clerks to take. Please review the director letter for any updates or changes to the Synar process. You can also review the current Nebraska legislation regarding underage tobacco compliance that we have included in your mailing. Next, review your clerk form shown here on this page. The first part is to review the current information in the top left-hand corner. This is the information that we have on file for the clerks for your county or municipality. If there are no changes and we have everything correct, you'll check the first box available. If there are changes, please check the second box and write in any changes or updates on this sheet. Second, you'll review the retail licensee list that we have provided in your packet, and these are the licenses that we have from the most previous year that the clerk had responded. Some clerks may have no licenses for their jurisdiction, in which this case you would check the first box. We understand that some jurisdictions may never have any licenses, but per statute and to comply with SAMHSA Synar guidelines, we must ask. If you review the licensee list and nothing has changed from the previous year, please check the second box so that we know that we have those retailers still have a license and we have the current information on file. If you review the list and have changes, such as licenses that are no longer in business, changes to license information, or new licenses, please check the third box and make any necessary changes on the licensee list. Finally, you can send this information back via email, mail, or fax. If you have questions about the process, we're more than happy to help, and you can reach us at 402-471-7857. Or you can email the dhhs.dbhtobaccolicensing@nebraska.gov. Since the Synar program was enacted in 1996, Nebraska has made substantial strides in reducing youth access to tobacco. In fact, since 2000, our retail violation rate has remained under the 20% threshold. Nebraska has since made it a goal to remain under a 10% violation rate for the entire state. As mentioned earlier, Nebraska has since adopted the Federal Tobacco 21 law, and effective October 1, 2020, tobacco sales in Nebraska to anyone under the age of 21 is illegal. To prevent underage tobacco use, we know that accessibility is a key factor. Being able to have a complete list of tobacco retailers for the state ensures that we continue to have a low violation rate. Currently, there are a variety of state policies that are in place to protect youth access and to prohibit the sale of tobacco, including smokeless and vapor, products to a minor. The Nebraska Statute 28-1419 states that any individual or licensee who gives or furnishes tobacco products to a minor is guilty of a Class 3 misdemeanor. Therefore, during the compliance checks, law enforcement must cite an individual, either the clerk or the manager or owner, for the criminal violation. This issuance takes place at the time of the offense to ensure that the person responsible for the sale is cited. The following data comes from our Youth Risk Behavior Survey, looking at cigarette and electronic vapor use among Nebraska high school students. While we have seen a decline in cigarette use for ever trying or past 30-day use, what's more concerning is electronic vapor use among youth. In 2018, almost half of high school students reported using an electronic vapor product during their lifetime. The proportion of students that reported using an electronic vapor product during the past 30 days decreased significantly between 2014 and 2016, but has since began rising. Few differences were seen by gender for lifetime and past 30-day use of electronic vapor products. However, as grade level increased, the percentage of students that reported lifetime or past 30-day use has increased for electronic vapor products. In 2018, nearly 1 in 4 high school students reported trying cigarettes during their lifetime, while more than 1 in 14 reported using cigarettes at least once during the past 30 days. The data on this slide shows which tobacco products were most commonly reported. When combining all types of tobacco, about 1 in 6 students reported using any form within the past 30 days. As expected from our previous slide, electronic vapor products were the most commonly reported form used, followed by cigarettes. The following are environmental prevention activities that are highly influential in reducing tobacco use among all ages. These include increasing tobacco and vape product costs, media campaigns, delayed onset of use, declining social acceptability of smoking, limitations on where smoking is permitted, product type and placement, and availability of accessible, affordable tobacco cessation options. Prevention coalitions and organizations may already be working to implement some of these strategies within your community. Many of you receive questions directly from tobacco retailers. To help retailers better understand their responsibilities and comply with the law, FDA does provide free webinars, training videos, and guidance documents. These free resources help to educate retailers and their employees about their responsibilities. You can click on any of these links here that will take you to many of the FDA's resources. How else can you as community members help? Ensuring that youth tobacco access strategies are part of your regional or county strategic plan or local tobacco control plan. Also, funding additional compliance checks throughout the year or utilizing coalition members to conduct non-enforcement compliance checks of tobacco retailers. You can also incentivize those retailers who are in compliance. Another option is to utilize media to publicize compliance inspection results. Thank you for taking the time to learn more about the Synar project and the role that you play in the process. We appreciate all of your time and effort. Please click the link to confirm that you have viewed the presentation. If you have any additional questions, please feel free to reach out at the number listed here. Thank you.